And you see different areas of the country take different action on this. When you were in Boston, I understand it was much less, but here in Miami, it's much more prevalent.
Yes, and that has been an interesting observation that I made since I've been in practice here for the past 14 months. You know, it's just a matter, could it be culturally related or not, or just fear of cancer itself, which oftentimes drives women to make these decisions for themselves. But the good news is that we have options, and we have a lot of education that we can provide for these women so that they decide for themselves what is the best for them in particular and their families. And one of the most interesting things that I've encountered is women who know they have the mutation and they decide to do nothing about it. They just want to wait.
And they would they have stepped up routine exams then? Do you counsel that a more frequent mammograms?
Absolutely. So when somebody has an increased risk or a non-genetic predisposition, they have a much higher risk of breast cancer that fall in the category that we might need to alternate mammogram with MRI, which is the most sensitive test we can do to evaluate the breast, so that way we can detect something if it's there.
And how do you walk through a woman who may want to have this procedure done?
It's a very lengthy process. And with that, you know, it's a very long conversation because the patient needs to understand all the risks and the benefits associated with this decision, because it's just something you're doing to save your life and also to maximize the prevention of a cancer, let it be ovarian or, you know, or breast cancer itself. But you need to be prepared, you know, psychologically, physically. It's a very tough decision to make for a lot of women.